Well, good afternoon, everyone. Happy New Year. Dr. Ezike has joined me today to help address the progress of the first 3 weeks of the vaccination process here in Illinois and what the next phase of access will look like for our 12.7 million residents. As of last night, approximately 344,525 total doses of the Pfizer and Moderna vaccines have been delivered to Illinois outside of the city of Chicago. In addition, 114,075 doses from Illinois' allotment have been set aside for the federal government's long-term care vaccination program, again outside of the city of Chicago, operated by CVS and Walgreens. Illinois as a whole has administered approximately 207,106 total vaccine doses to date, including yesterday's first round of second doses for the early December first dose recipients. That number also includes vaccinations through the federal long-term care vaccination program, whose partners only started vaccinating in Illinois on December 28th. Nearly 2 weeks after our first state-delivered vaccinations. These first vaccinations have taken place following the Phase 1A recommendations of the CDC's national recommendations with input from IDPH. That first phase includes healthcare workers and nursing homes and long-term care facility residents and staff, which we now approximate as 850,000 eligible Illinoisans. Up to now, this vaccine has only been offered to a very specific group of people at very specific locations in staggered proportions because hospitals and nursing homes have been concerned about too many of their staff receiving the vaccine on any given shift. Because of this and because of the early federal supply issues, so far approximately 1/3 of our healthcare workforce outside of Chicago has received the vaccine. IDPH continues to work with local health officials to ensure the rapid administration of these vaccines to all members of Phase 1A who consent. I had hoped to see an increase in the number of vaccines delivered to us from the federal government after I announced federal delivery reductions to you in December. The delivery of vaccine has remained at a lower pace than expected. Illinois has now allotted approximately 120,000 doses per week, 60,000 each of Moderna and Pfizer. From that number, the federal government pulls out the long-term care allotments. We have updated our early January planning for Illinois according to this lower than expected federal delivery schedule. The good news is that the incoming Biden administration has pledged to invoke the Defense Production Act so that we expect the vaccine production will grow significantly over the coming month. Despite the early slowdown of federal deliveries and with high hopes for increased vaccine availability going forward, today I want to address the specifics of what the next stage, Phase 1B, will look like in our state when we have substantially completed Phase 1A. As a reminder, the only reason that we must phase in this rollout of the vaccine is the scarcity of its availability. The need to prioritize is a function of that. Last month, the CDC's Advisory Committee on Immunization Practices, ACIP, met to provide further guidance on upcoming phases of vaccinations. By design of the federal government, the actual administration of vaccinations has been left to states and to cities, and the ACIP guidance is intended as a well-thought-out set of recommendations that states can then tweak to best serve their unique populations or unique challenges. I want to commend ACIP for its efforts, which have been very important in our process. None of the decisions that ACIP made were easy, and none that fall to the states are easy. Broadly, ACIP's recommendations are focused very properly on preventing illness, saving lives, and restoring the functions of society, which is why their guidance on Phase 1B has included, importantly, seniors 75 and over and frontline essential workers. And I'll dive into how the CDC defines that term in just a moment. ACIP's guidance serves as the foundational blueprint for Illinois' Phase 1B plan, with one key adjustment. Here in Illinois, we are more strongly pursuing equity in the distribution of our vaccinations. Let me begin by talking about ACIP's recommendation that Phase 1B include only seniors who are 75 years old or up. I believe strongly that we ought to protect more of our seniors earlier than ACIP has recommended. For the last 10 months, we have seen the fundamental vulnerability to COVID-19 of the entire population of our seniors, not just those 75 and over. And importantly, the average age of death from COVID-19 is much lower than 75 for Black and Latino Illinoisans. While the average white person in Illinois who died from COVID-19 passed away at age 81, the average age of COVID-related death for Black Illinoisans is 72, and it's 68 for Hispanic Illinoisans. For people of color, multi-generational institutional racism in the provision of health care has reduced access to care, caused higher rates of environmental and social risk, and increased comorbidities. I believe our exit plan for this pandemic must, on balance, overcome structural inequalities that have allowed COVID-19 to rage through our most vulnerable communities. Lowering our minimum age for vaccinations in Phase 1B is one critical component in addressing that. So the one area where we are diverging from the ACIP recommendations is this. In Illinois, if you are 65 and over, you can get vaccinated in Phase 1B. We've adopted the rest of ACIP's Phase 1B recommendations, which is mostly focused on frontline workers, a group that in many of these industries is disproportionately made up of people of color. The ACIP term frontline essential worker is really focused on those individuals who carry a higher risk of COVID-19 exposure, in large part because their work duties can't be performed remotely. So they spend more time in proximity to other coworkers or members of the public. The CDC estimates about 30 million Americans are frontline essential workers. That includes first responders like firefighters and police officers, educators like teachers, support staff, and child care workers, people in essential industries like the postal service, manufacturing and distribution, public transit, food and agriculture, grocery stores, and congregate facilities. All in all, Phase 1B totals approximately 3.2 million people throughout the state of Illinois. As we enter this next phase of vaccinations, I have directed my team to utilize every available state resource, a massive infrastructure and logistics effort, to get this vaccine out to as many people as possible, as quickly as possible. A vital component of that is our extraordinary Illinois National Guard, who orchestrated the development of our robust public COVID-19 testing infrastructure early on in the pandemic. Under General Richard Neely's direction, the Guard will bring their expertise, their precision, and their efficiency to standing up mass vaccination sites across the state. We're also actively increasing the number of providers registered to administer vaccinations so that we can implement widespread and equitable availability as more and more vaccines are delivered to our state. As we do this, my administration has also issued additional non-discrimination guidance to ensure vulnerable and historically marginalized communities receive equitable, informed access to these vaccines. Our goal is to expand vaccination infrastructure right now, including especially in communities that have been disproportionately impacted, to move these vaccines through our state at an even faster pace as we see an increase in federal deliveries. In summary, once we've substantially completed vaccinations of healthcare workers and long-term care facilities, and as federal vaccine deliveries increase, we will move into Phase 1B, which will cover everyone in Illinois 65 and over, plus frontline workers. Our IDPH team continues to review ACIP's recommendations for Phase 1C, and Dr. Ezike and I will provide a further update on that sometime over the next few weeks. Finally, before I turn it over to Dr. Ezike, I want to make an announcement regarding the Tier 3 mitigations currently in effect across the entire state. Since November 30th, I have maintained, at the advice of Dr. Fauci, of Dr. Ezike, of IDPH, and other infectious disease experts, that it would be unwise to downgrade any region from our current Tier 3 mitigations while in the holiday season, when people were particularly prone to gather in multifamily groups and do it without masks, the thing that could deliver the worrisome surge upon a surge. I'm incredibly grateful to the people of Illinois for making the difficult choice to take extra caution around Thanksgiving. Illinois did not experience the post-Thanksgiving uptick at a rate that plagued most of the rest of the country. And we're watching closely in this incubation period post-Christmas and New Year's. I'm cautiously optimistic, as there are some early signs indicating that some regions have made real progress and won't reverse that progress this week or next. So on January 15th, exactly one incubation period from New Year's Day, any region that has met the metrics for a reduction of mitigations will be able to move out of Tier 3 of our mitigation plan. My prayer for the new year is that everyone stays healthy and all of our regions continue to move in the right direction. And I ask all Illinoisans to join me in making that possible by wearing a mask and keeping your distance. Thank you, and with that, I'd like to turn it over to Dr. Ezike.
Good afternoon and Happy New Year. I am really hopeful and optimistic that 2021 will be a great year, and part of that optimism is because I get to be standing here sharing information about the next phase of vaccines. We are getting shots into arms, and that's exactly what we need to end this pandemic. As the governor mentioned, we want to make sure that we are equitable in vaccine prioritization and that we recognize the populations at highest risk. And that means both the highest risk for exposure as well as the highest risk for severe illness and death. The Centers for Disease Control and Prevention recently adjusted COVID-19 mortality rates by age. In doing so, the CDC found that Latinx and Black Americans were dying at a rate of almost 3 times that of white Americans. In Illinois, the average age for COVID-related deaths among Black populations, as the governor mentioned, is almost 10 years younger than the white population, and then the average age for the Latinx population is 12 or 13 years younger. These data highlight the importance of recognizing the age differences in the data to inform our actions going forward and the recommendations that follow. While the highest count of COVID-19 deaths is among those 75 and older, the majority of our Black and brown populations are dying well before that. And therefore, we need to make vaccine available to all those at higher risk of death. These disparities, again, as mentioned by the governor, are the result of many factors: reduced access to health care, lack of quality health care, undiagnosed or untreated pre-existing conditions, some distrust of medical providers, as well as the social and environmental factors that can increase the risk for exposure, such as the higher likelihood of being an essential worker, having multiple generations or many, many people living in a single home or household, and then, of course, having a job where working from home is not an option. Excuse me. So throughout this pandemic, we have been working closely with our minority communities to make sure that we increase access to testing, and as well to provide information and educational resources. And we're doing the same with regards to vaccine information. We're working with faith-based communities and faith-based organizations, community-based organizations, and our community ambassadors to get this important information out, to dispel myths and allow the truth to be shared. Our outreach extends to all populations in Illinois, Black populations, white, Latinx, Asian, immigrants, all groups, including individuals that are undocumented. And undocumented individuals will not be turned away when they present for vaccination. We will continue to use our data to inform our path going forward, as we've done all along this journey. Today, 7,569 new individuals have been diagnosed with COVID-19, and that brings our total to nearly 1 million cases in Illinois since the beginning of this pandemic. And over the last 24 hours, we also received reports of 139 individuals who lost their battle with COVID, and that brings our death total for Illinois to 17,096 individuals. 3,928 individuals were in the hospital overnight with COVID, and of those, 812 were in the intensive care unit, and 451 patients were on ventilators. In the last 24 hours, more than 80,000 COVID tests were resulted, for a total of more than 13.6 million tests since the beginning of this pandemic. We still have a long way to go, but we're definitely on our way. The vaccine, as the governor mentioned, continues to be limited, and we are working with providers to get what vaccine we do have into the arms of Illinoisans as quickly as possible. But we also need to get it into the arms as safely as possible and as equitably as possible. This morning I was just reminded of a proverb: just as iron sharpens iron, one person sharpens another person. And that suggests that we all need each other to be better. We're not in this alone. You can say all the right things, you can do all the right things, but if I'm not doing it also, I'm not only putting myself in jeopardy, but you in jeopardy and our entire community. So quite frankly, the masking, the continuing to postpone any mass gatherings, the need to get vaccinated, all of those things we all need to do together. I implore your support as we move through the end of this pandemic by doing the safety mitigations and taking advantage of this medical miracle that we have in the form of the vaccine. Thank you, and now I'll summarize comments in Spanish. Feliz Año Nuevo a todos. Me alegra estar hoy aquí y compartir información sobre la próxima fase de vacunación. Esto significa que estamos recibiendo inyecciones en los brazos, que es lo que necesitamos para poner fin a esta pandemia. Como dijo el gobernador, queremos asegurarnos de ser equitativos en la priorización de vacunas y reconocer las poblaciones en mayor riesgo. El CDC recientemente ajustaron recientemente las tasas de mortalidad de COVID-19 por edad. A hacerlo, el CDC encontró que la gente latinx y afroamericana estaban muriendo a una tasa de casi 3 veces mayor que la raza blanca. En Illinois, la edad promedio para las muertes relacionadas con COVID-19 entre las poblaciones afroamericanas es casi 10 años más joven que las poblaciones blancas. La edad promedio de las muertes relacionadas con COVID-19 para las poblaciones latinx es 12 a 13 años más joven. Estos datos muestran la importancia de utilizar datos ajustados por edad para informar nuestras acciones en el futuro. Si bien el recuento más alto de muertes por COVID-19 se encuentra entre las personas de 75 años y arriba. Sabemos que la mayoría de las poblaciones de Latinx y afroamericanas están muriendo a edades más jóvenes que eso. Por eso debemos dar la vacuna a todos que tienen a mayor riesgo de muerte. Estas disparidades son el resultado de muchos factores: falta de atención médica de calidad, condiciones preexistentes no diagnosticadas o tratadas, desconfianza en los proveedores médicos, y también hay factores sociales que pueden aumentar el riesgo de exposición, siendo trabajadores esenciales, tener un trabajo donde trabajar desde casa no es una opción, y varias generaciones viviendo en una casa. Vamos a continuar utilizando nuestros datos para informar nuestro camino a seguir adelante cuando hay más vacunas disponibles. Hoy hay 7,569 personas nuevas con COVID-19 para un total de más de casi 1,000,000 casos en Illinois. Desde ayer hemos recibido informes de 139 personas con COVID-19 que han muerto por un total de más de 17,000 vidas perdidas en Illinois. 3,928 personas estuvieron en el hospital desde noche con COVID-19. De ellos, 812 pacientes estaban en la unidad de cuidados intensivos y 451 pacientes estaban en ventiladores. En las últimas 24 horas se han informado más de 80,000 pruebas de COVID-19 fueron hechas para un total de más de 13,6 millones de pruebas aquí en Illinois. Aunque nos queda un largo camino adelante, estamos en camino para acabar con esta pandemia. La vacuna sigue siendo limitada en este momento y estamos trabajando con los proveedores para que la vacuna que tenemos esté disponible de la manera más rápida, más segura y más equitativa que posible. Permítanme terminar con esto. La vacuna COVID-19 es para toda la gente de Illinois. Nadie será rechazado, especialmente nuestros trabajadores esenciales indocumentados que han hecho que Illinois siga adelante durante esta pandemia. Por favor, entiende eso. Mientras tanto, debemos seguir los 3 M's. Usa su máscara, mantenga su distancia y lavar las manos. Muchísimas gracias por su apoyo. And with that, I will turn the podium back over to Governor Pritzker.
Thank you, Dr. Ezike. Before I take questions, I want to address the unfathomable and disgusting remarks that the newest member of the Illinois congressional delegation made, Mary Miller. Let me be clear. Hitler got nothing right. This reprehensible rhetoric has no place in our politics. Illinois Republicans cannot allow this to stand and must condemn this vile, evil streak in their party. If Representative Miller was the least bit interested in history, she would visit the Illinois Holocaust Museum and Education Center to learn just how wrong Hitler really was. With that, I'll be happy to take questions from members of the media, and Happy New Year to everybody.
You mentioned that the Illinois National Guard are they going to be doing inoculations? And would this take place at McCormick Place or Soldier Field? Have you guys planned that out yet?
All of that is in the works, and the answer is you have the right idea. They'll be assisting others and doing it themselves, depending upon their expertise, of course, and using arenas, as you're describing, all across the state and in conjunction with local leaders to make sure that they've got the right locations and there's enough parking and enough access for everybody. Yes, sir.
We're hearing reports that vaccinations among healthcare workers are perhaps lower than had been expected. Is that something that you can confirm? And if so, what does that do to the supply?
So I have heard that for example, at private hospitals, that there is a choice being made by some healthcare workers not to be vaccinated early. And let's be clear about it, and let's try not to blame, at the moment, people who are choosing not to do it. There's vaccine hesitation among lots of people. And even among the most educated people, I have heard people say, well, I want to see someone else get it first and see how they react, or maybe I want to wait till someone gets their second dose, and then I'll go for my first dose. So, I do know that there are people who are choosing not to be vaccinated. And I've heard this at private hospitals. I've seen it. That isn't going to stop us. We are going to continue, and people are choosing to uptake as we go here. There will be, as education is done, as people understand this better, as they become more comfortable with it and they see more people get it, I expect that more and more and more, not just healthcare workers, but others, as we open up to 1B and 1C, will want to get vaccinated.
Is it enough that it is creating more of a surplus of the supply than you would have expected?
No, no. Whatever is, not being chosen to be uptake, by somebody to have injected in their arm is being given to somebody else at that facility. The facilities themselves, the hospitals, for example, are telling us, because they discuss this with their workers, how many vaccines they need to have doses they need to have delivered, and then we're delivering those doses. And if they have leftover doses from any given day, they're giving them on the next day.
How are you anticipating folks in 1B will be able to sign up to get this vaccine?
Yeah. So we have electronic means for scheduling. That's one thing that'll be in 1B. So by appointment, but obviously in mass vaccination sites, you'll have multiple people with appointments at similar times, right, every few minutes, and in multiple lines of people that may want to get vaccinated at any given moment. So that's one way. Obviously, educating people about where they can go. In some places, there will be a lot of people that want to get vaccinated very early. In other places, it'll be staggered. So it will depend on the location and the desire of people who live in that area who qualify.
And at the current rate that we're receiving the doses, I know this changes and we have less than we were expected, but do we have any idea on when we might be moving toward the end of 1A and into 1B, any sort of timeline?
Yeah, it'll be a few weeks from now, because we're still, getting all of the long-term care facilities covered, and there are still healthcare workers that are being covered. And we're waiting for more and more vaccine to arrive. That's really the biggest holdup to getting through the entire thing is that. But there are lots of features of, the speed with which we can get this into people's arms, and we're working as expeditiously as we can.
So since we didn't have a Thanksgiving surge, and right now hospitalizations are down about 2,000 from the peak at the beginning of November, why not let people go back to just phase 4 right now?
I appreciate the question, and let me say that while we didn't see the kind of surge that we expected, you did see some hiccups, let's say, along the way, and even over the last week, where you saw, some of our positivity rates really start to climb again. So why not do it now? Because we're right now literally in the post-Christmas incubation period, and then post-New Year's Eve. We all know that there were people who chose to have a party or chose to get together with lots of other people, which we've asked them not to do, but people did it anyway. We want to make sure that we're keeping our infection rates as low as possible, and so we've scheduled essentially one incubation period after January 1, which is why January 15th is when, and by the way, these regions can move down not just to Tier 2, but wherever they belong in terms of what their infection rate is and what their hospitalization rates are.
We'll do two more in the room, and then we got to get online.
Yeah.
Just real quick, you mentioned the Defense Production Act, which President-elect Biden might enact. Do you have any anticipation as to what impact that might have on production?
In terms of the numbers,
yeah.
It's hard for me to estimate because I haven't been to the facilities that are manufacturing this. But I do expect that the ramping up will get to a point where we'll get hundreds of thousands per week of vaccine. I mean, right now we're not getting hundreds of thousands. We'd like to see 500,000 per week, and we're hopeful that we can get to that point. But it's hard for me to predict exactly when we would get there or exactly how many will be delivered, but my expectation is it'll be a lot more delivered to the state of Illinois once the Defense Production Act is invoked.
I'm a little bit of a nerd, but I watch other governors' COVID-19 updates. And Governor Walz in Minnesota, he stopped sports and said, give me 3 weeks, I'll come back to you. And then he came back in 3 weeks and said, all right, this is what we're going to do. We're going to start practice.
Yeah.
Can we, I just feel like the parents and the kids who need something right now,
Yeah.
they are dying on the vine.
Yeah.
Okay? Can you meet with IHSA? They feel like communication has been completely cut off.
Yeah, there's.
And they're meeting
Yeah.
January the 13th, and they want you or Jesse Ruiz or somebody.
Yeah.
Because we need to get the ball rolling here. Our kids are suffering beyond.
Yeah,
what we
but
can
remember, it's not like there's no discussion that goes on about sports. It's just that the IHSA, which is one of many organizations in the state of Illinois, just that the IHSA isn't part of those discussions, that we have doctors and others that we rely upon internally to help us make some decisions. And then when we're at a point where it's appropriate to have a conversation with one of the organizations or a number of them, we'll do so.
All right, last question.
Okay, okay. I do have two from my colleagues that are very different topics.
Let's make it quick.
Okay, so first and foremost on the new strain, I know Dr. Zika, you mentioned you were monitoring it. Has it been identified here in Illinois? And is there any indication that it could be more contagious in children?
Actually, I'll let Dr. Zeke answer.
Okay, and then the second one, sure, you go.
Okay, so this UK variant, the B.1.1.7, obviously has been identified in some states in the United States. We have not identified it here yet, but that does not mean that it's here, that it's not here. So the likelihood that it's here is very, very high. We do genomic surveillance, where we do the genomic sequencing to look for this variant, so we haven't found it yet. In the samples, we obviously don't test every single sample, but of the samples we have generated, we have an internal team in the state that does sampling, and we also send samples to the CDC, and between all of those samples that have been sent, we haven't found it. That doesn't mean, again, it's not here, but it means that it's not in a high enough percentage proportion compared to the other circulating strains to suggest that it's predominant. I want to remind you that in the UK, it was about 80% of all the strains, and so that's why it was very clear that it had taken over the others. That's clearly not the case here, or we would have found it in even the sampling that we're doing now. So we will obviously continue our sampling, the sequencing, and we will let you know as soon as we find it, and then we will continue to be monitoring. In terms of the higher transmissibility, again, we don't have the data here to suggest we are following the data that we are hearing from our partners across the oceans, just as you are. They are suggesting, based on inference, not really clear cause and effect data, but by inference, they are seeing that it looks like the kids might have a bigger role in this and that there's higher transmissibility. What does that mean for us? That means that we need to double down on the efforts that we're already supposed to be employing. So, if we've been lax and said, I'm not so much of a fan for my mask, in 2021 I want to do things differently, that's not the right move, right? We need to be more vigilant because potentially it takes fewer particles of this virus to cause infection and illness. So that means you don't want to have even a moment extra without our mask, that the more likely, the larger gatherings, you are more likely to get infected even with a brief encounter. Maybe 15 minutes is not a thing. Maybe with 5 minutes that could do something. So the large gatherings, the using of the mask, those are things we need to double down on to protect ourselves for COVID in general, and if we have this UK strain, this variant.
And Governor, quickly, what is the state doing to prevent unemployment fraud, and is there a breach or hack in the system? One of my colleagues at NBC Chicago says many people are receiving notices that someone filed unemployment claims in their name, and it's often taking weeks or months to get resolved, if at all, and they're unable to get their own benefits if someone's doing this in their name.
So there's not been a hack detected in our systems. That's not a thing. People are using information, is what we understand, that they've garnered from other hacks that have occurred sometimes a couple of years ago. I've cited a few of these, but you remember when one of the credit bureaus was hacked a couple of years ago, and Target and some of the other retailers. That information is sometimes held for some period of time. They don't just immediately go out and start charging on people's accounts or using that data. Sometimes they just hold it in abeyance, hoping that you won't do anything. If you're a Target card holder, for example, that you won't go check your credit, that you won't, that if nothing's happening, maybe nothing will happen. And then they strike at some point in the future. This is an example of how people are now being used. Their information is being used in a fraudulent fashion at IDES. A lot is being done to try to prevent that, and most of all, to even if someone receives a letter or they receive a card or something like that, to make sure that there's actually no effect on them. That's a lot of what we're focused on, is just to make sure there's no real effect on somebody.
Okay, Grace at Capital News Illinois is asking, when do you anticipate to see an increase in the federal distribution of the vaccine, and what does that increase rely on?
Yeah, I'll repeat what I said a little bit earlier, which is we think that we are, with the invocation of the Defense Production Act, that we will see increases of deliveries of vaccines to the state of Illinois. So when that will happen, again, I think we have to get the new president inaugurated, and then he's got to invoke the Defense Production Act, and then the various manufacturers have to ramp up production under the Defense Production Act using what's being provided to them under it. And then the last thing is, as some of you may have read, Johnson & Johnson and AstraZeneca and a few other companies are getting ready to or have applied for an EUA, an emergency use authorization. And whenever that is granted, that will give us yet another manufacturer and other manufacturing facilities to rely upon. So I'm hopeful that all of those things will allow vaccine production to increase significantly.
Dean Olson at the SGR, are we starting to see a surge from end-of-year gatherings?
It is very hard to tell. I mean, I just want to be clear that what I can tell you is we've all seen, I think he's asking this question because of it, we've all seen that the positivity rates have gone up. We also know, though, that fewer people got tested around the holiday. They were busy, or they weren't feeling poorly, or weren't doing things that were preventative. And so, as we see people get back into testing today, we had a higher number than in previous days, and so on. We're going to see whether the positivity rate is stagnant or moving down, and so hard to really answer the question. I don't think it is moving in the wrong direction, but as you saw by the tilted head of my colleague, the director, we don't know, is the truth.
Jonah Meadows at the Patch, according to the CDC, Illinois ranks 21st among states in percentage of vaccines administered. Does the state expect to increase that percentage, and if so, when and how?
What was the cited information?
The
21st in what?
In states, so I think he's got this a little bit wrong.
Yep.
According to the CDC, Illinois ranks 21st among states in the percentage of vaccine distributed to be administered, about 33%.
Yep.
Does the state expect to increase that percentage,
Yep.
and if so, how? The CDC is actually tracking administered vaccine, not distributed. But
yeah, and I want to try to set everybody straight on the numbers here. What gets reported immediately are the deliveries of vaccine. What gets reported sometimes 24 hours, 48 hours, or 72 hours later is that someone had that administered. So once you have it administered, whoever gave it to you, the vaccine, has literally 72 hours by CDC guidance to let us know that they administered that. They can do somebody in 24 hours, report that, and they can report at the same location the next person 48 hours later, and that's all allowable. So it's a little hard, to just say exactly where we are. I will tell you, though, that among the top 10 most populous states in the United States, we are doing very, very well. The folks who have widespread distribution and administration challenges in the big states, we are really competing quite well, if you want to look at it that way, and getting vaccines out in a relatively quick fashion. I want to do even better. It's why we're going to have the National Guard brought in. It's why we're going to open up so many other locations. But I consider this a race to get vaccines in people's arms as fast as possible. And that's the measurement that we all should be focused on. It's not distribution. Distribution is literally the delivery of boxes of trays of vaccine to a location. It's the administering of those vaccines into people's arms that is what really counts.
Yvette at Bond Buyer, what prospect of the Senate changing hands, what does that have on your budget plans? And do you expect during lame duck session or early in the new legislative session to fully close the FY21 budget hole, and will you seek a tax hike?
And what was the time period she was suggesting that we would get the budget hole closed?
During the lame duck
Lame
session
duck.
or early in the new legislative session?
Yeah. So, I mean, certainly our goal is we have to close that budget hole as soon as we can. Lame duck is relatively short, so it's difficult to do everything that we need to do to close the budget hole. And we have not yet heard from the Republicans after they're demanding that there be cuts, what their cuts proposal is. So that's one challenge we need to overcome. As far as let's see, as far as the overall benefit of the Senate changing hands, I think let me start by saying congratulations to the two new members of the United States Senate on their wins overnight. Really terrific, amazing results in Georgia and a state turning blue. I'm thrilled about, and the fact that the Senate changed hands is even better. As far as how that'll affect the state of Illinois, well, let me just say I think there are two things immediately that we could all point to. One is that I think we will start to see serious consideration of state and local funding finally because Mitch McConnell won't be able to block it. And there are Republican senators whose states need state and local funding, and they were working on that behind the scenes, but Mitch McConnell would not bring that to a vote. So I think that will be brought to a vote under the Biden administration, under the new leadership in the United States Senate. And the second thing is, and this I think is extraordinarily important for everybody in Illinois, and that's the elimination of the SALT deduction will be reversed, in my opinion. This is the state and local tax deduction that used to exist that President Trump fought to get rid of because he wanted to punish big states in the United States, particularly those that lean Democratic. And so I think that we will see some movement on eliminating the prohibition on state and local tax deductions.
Cassie Walker-Burke.
That'll be great, by the way, just for everybody. That will be great for everybody's, lowering everybody's tax bill and, burden of property taxes.
Cassie Walker-Burke from Chalk Beat, Chicago. Any more specifics on where teachers could fall in line in 1B and a timeline? The CTU has now asked for the city to delay reopening until teachers can be vaccinated.
Teachers are in that category of 1B, and so they'll be able, as the vaccines arrive, they'll be able to visit one of the sites that we're setting up or any other provider that's registered in order to get vaccinated. And also the city of Chicago in particular, which controls its own vaccine distribution, has the ability to set up sites that might be more convenient specifically for teachers.
Jim Leach at WMAY, any updates on efforts to get AFSCME to go along with furlough days or on other efforts to close the budget gap?
Nothing to announce yet.
Hold on 1 second. What do you hope, this is Joel at the Daily Line, what do you hope is taken up during lame duck session? Are you pushing any particular issues heading into the start of the 102nd General Assembly? And do you have any preferred House Speaker candidate?
So there are a number of things that I think should be taken up in the lame duck session, which again is relatively brief. But one of them, which not many people have talked about, is it's a decoupling issue. There's a tax provision as a result of the CARES Act passage that would essentially deprive Illinois of revenues that it otherwise should get. And so it's literally a technical fix that we ought to just do. It's good for everybody in the state. And so that's something that I would like to see done in the lame duck session. And then, of course, there are quite a number of things that the legislature itself has suggested that they might take up, including, issues that the Black Caucus is raising that that I favor, and I'll work with them on.
Jake Griffin at the Daily Herald. While ultimately everyone needs to be vaccinated, should hospital employees that work mostly from home or away from the front line, like finance and public relations, be getting vaccines while Phase 1B essential workers and the elderly continue to wait?
Look, rather than focus on the exactitude of the delivery to exactly the right, that we are focused on healthcare workers, facilities and hospitals are trying to get to the frontline workers first. I know that all of them prioritize frontline workers. And working their way backward. Anybody that comes in contact with a frontline worker that's at the hospital comes in contact on a regular basis, and so on. So the intention, I think, is to get to the right people. Those who are administering, so far have shown that they have good intentions to follow the ACIP guidelines, and we expect them to do so. Indeed, they agree to do so when they accept vaccine.
Sean Ballant is asking if you would share your thoughts on Senator Menard leaving the chamber to join the team.
Well, I'm thrilled that Senator Andy Menard will be joining our administration shortly. I think anybody that knows him knows that he is one of the most thoughtful state senators that has served in the state Senate. I know that there are many people in the state Senate who will see it as a real loss for them, that they have a colleague who's leaving them during this session, which will be challenging and interesting for everybody. But he will still be working in state government in a very important position, advising me. I rely upon him as somebody who tells the truth, who knows the process better than almost anybody. And I'm looking forward to having daily working relationship with him.
Aaron at the Hyde Park Herald, we continue to see high rates of vaccine hesitancy among Illinoisans of color, though the issue is at play across the state with people who have lower educational backgrounds and et cetera. What is state government going to do about this, specifically state policy, or pursue action or advocacy campaigns?
So we are doing education campaigns to make sure that people of color and others who may be vaccine hesitant will learn, understand how important it is to get vaccinated. As I said a little bit earlier in answer to a question, I think that many of the people who are hesitant to get the vaccine want to see someone else get it, someone that they know, someone that they can ask a question to, like, hey, how did it feel? If you've gotten your second dose, is everything okay? Is everything going well? And I think that is a lot of how people who are hesitant are thinking about whether or not they will get the vaccine. But there are others who have questions, and as a result of that, we're providing frequently asked questions opportunity online for people to get information that they need. We want everybody to know that these are safe, that you've seen them administered already around the world, not just in the United States, around the world to tens of millions of people. So we now know that it is in fact safe. And anybody that looks at that will know, and feel comfortable about that. But there's a lot of work to do to make sure that people understand what this is and what it isn't. It's not like other vaccines. It's actually safer in many ways because there's no live virus associated with it.
Have you gotten a vaccine yet?
I have not.
No. Kelsey Landis at the Belleville News Democrat is going to be our last one.
Yeah.
In what phase will all state lawmakers, not just those who meet the other criteria, be eligible to receive the vaccine? Is this a priority to ensure continuity of government?
Anybody who is eligible under any of the phases who serves in government will have the opportunity to get vaccinated when their phase comes up.
All right. Thanks, everyone.
Thank you.